Health and Human Services Secretary Robert F. Kennedy Jr. says that he wants the CDC to stop recommending fluoridation in drinking water. Kennedy is citing what he calls new scientific information on the potential health risks of fluoridation. Joining us now is Will Humble, Executive Director of the Arizona Public Health Association. Will, good to have you here. Thanks for joining us.
Thanks, Ted.
What is fluoride?
So it's on the periodic table.
Okay, all right.
Here. It's a mineral that, when it's in drinking water, provides extra protection for your teeth so that you're less likely to get cavities. So it's perhaps the #1 oral health intervention of the last century, maybe of all time, because it provides really good protection against cavities. In fact, properly fluoridated water reduces the prevalence of cavities and tooth decay 25%.
Okay, how long has fluoride, though, been in drinking water?
It goes back to the middle of the last century. So in the 1960s, et cetera, some of the cities began to use that public health evidence to start fluoridating water, and it grew from there. At this point, we're in kind of a stasis over the last 10 years, at least in Arizona, where the cities that fluoridate in Arizona, Phoenix, for example, Tempe, Glendale, Mesa, Chandler, they all fluoridate their water to optimal levels. But we have a lot of places in the state that don't. Tucson, for example, has never fluoridated. Paradise Valley, Scottsdale, Carefree do not either.
Do we know why they don't? Those areas don't?
These decisions are made by city councils. So, like Kennedy says, he's against fluoridation in drinking water. That's not an edict that can come from the U.S. Department of Health and Human Services. They can provide recommendations and guidance, but it's city councils who make the decision to invest the money in the engineering that allows the water people to add the right amount of fluoride to the water system. So it's a city council decision ultimately.
Why do some people oppose fluoride in drinking water?
Well, I was at a city council meeting in Phoenix in 2012, I think, and the kinds of things that they were saying they were urging the city council in Phoenix to stop fluoridating water. They were saying just preposterous stuff that has no basis in evidence.
Like what?
Like mind control. I mean, believe it or not, they thought it was it's a mind control thing. So I mean, preposterous, of course, but and with social media and people having sources of information that aren't checked, where there's no editorial review, that stuff begins to mushroom and becomes worse and worse over time. Although I have to say, it's not like we've seen a big erosion in cities dropping fluoridation in their drinking water in Arizona yet.
Because the recommendation. Okay, Fox News. Meta-analysis shows possible detrimental effects from having fluoride in drinking water, mostly on health of pregnant women and infants. Have they got something there?
I have not seen whatever meta-analysis they're talking about. I can say I've looked at the literature frequently, and I knew I was coming on the show, so I looked at it again. I didn't see that meta-analysis. What I can say is that there are many systematic reviews. So you could have individual studies about what fluoride does and doesn't do and what the harms are, potential harms, to just evaluate that stuff. And then you could do what's called a systematic review, where you do a study of the studies.
Yes.
And those systematic reviews consistently show that it's safe and effective. So now I have to say, if the water has more than 1 part per million, the recommendation is 0.7. That 2% of the people will get what's called fluorosis, so a discoloring of the enamel, which is cosmetic. And that's the
all right
effect.
Okay, but here's some other claims. Harmful impact on bone strength, harmful impact on thyroid function, and harmful impact on cognitive development.
So with bone strength, with bone strength, that happens above 4 parts per million. So what we're talking about, fluoridating water, is to 0.7, less than 1 part per million. So when you get over 4, you can start to have those skeletal problems, like is in that study. That's why the U.S. Environmental Protection Agency says you can't have water that delivers more than 4 parts per million. So like 0.7 is helpful. Just like everything in toxicology, by the way. Like the number one thing you learn in toxicology is the dose makes the poison. So it's therapeutic at 0.7. It starts to become potentially harmful for people who drink a lot of water over 4. But our water systems don't have that because the EPA stops you at 4.
And yet, RFK Jr. specifically said that the benefits to fluoride, they're mostly topical, that you don't need to ingest fluoride, and by ingesting fluoride, you're asking for trouble. Yes, fluoride's good for the enamel, but don't ingest it.
Well, then he's pro-cavity. That's all I can say.
But do you understand what he's saying? He's saying you don't need to drink the water. It can't be in the drinking water. It's okay for toothpaste and everything else to be topical.
I saw that study. I reread that study before the show.
Yeah.
So drinking, even though there is fluoride in toothpaste and so forth, drinking, when you add it in drinking water, there is still a protective effect. And in fact, the water fluoridation recommended level used to be 1 part per million, but because of all of those other sources in toothpaste that have become more common over the last 20 or 30 years, CDC reduced that recommendation to 0.7. So they're using the evidence over the last couple decades. They've used the evidence to help guide what the recommendation is. And we've talked on the show before about my biggest concern about Mr. Kennedy was his lack of using evidence to drive his opinions. And that's one thing when you're a lawyer suing people. It's a completely different thing when you have the power of the state. And that's the problem.
One more RFK statement here. More fluoride you get, the lower your IQ is going to be.
I don't know where he's getting that.
Okay. So when he wants the CDC to make this recommendation, and last point on this is, as you mentioned, this is the city councils have to figure this out. This is local. This isn't national. However, the CDC recommendation in and of itself, how big a deal is that?
Depends on the jurisdiction. You know, I like take for example the city of Phoenix. If the CDC were to, under Mr. Kennedy's reign as secretary, to say we don't think you should fluoridate water, I don't think the Phoenix City Council would be compelled to drop fluoride because of that. Are there jurisdictions that would respect him and his part in this administration enough to drop it? Yeah, that could happen, I think.
Will Humble, Arizona Public Health Association, very interesting stuff. Good to have you here.
Yeah, sure.